Hi, I'm Dr. Sarah Conrath, a professor at Indiana University and Notre Dame University who studies the science of giving. Today, I'm going to give you a tour of the many different ways that giving can be good for givers, according to science. The joy of giving. I made this video for the Florida Keys 21st Annual Unsung Heroes Celebration, which was organized by the Community Foundation of the Florida Keys. We're here to celebrate volunteers like you, and thank you for your service. Many of us believe that if we only had more time and money, we would be happier. In fact, there's much research finding that giving away our time and money makes us happier, even though, of course, after giving, we have less for ourselves. Research finds that people who regularly volunteer have higher happiness, self-esteem, and psychological well-being than those who don't. They also have lower rates of depression. Helping others doesn't need to be done in the context of a nonprofit organization to increase well-being. Research finds that being kind to others in many different ways feels pretty good. What about giving away money? Research finds that giving money to others, including charities, makes people happier than spending it on themselves. In fact, simply remembering a time that you spent money on others has similar mood-boosting effects. Even when people are aware of the potential happiness benefits of giving, this doesn't reduce the psychological rewards. Even more incredible is that these happiness boosts are noticeable by others. The joy of giving is written on your face. These effects are pretty strong and have been found in many studies. And yet, most people think they'll be happier when spending money on themselves instead of others. But as Volunteers of the Year, you've already discovered this is not true. Research finds that giving money makes people feel richer, and giving time to others can lead to feelings of time affluence. This is despite the fact that objectively, people have less money and less time because they just gave some away. Scientists have also found that giving is contagious. People's giving behavior spreads into their closest friendships and family members and into their broader social networks. Volunteers like you are creating a kindness pandemic. Giving enriches people's social relationships, both in quantity and quality. Kind people are likable, and others want to be around them. In fact, the number one trait that both men and women are looking for in a romantic partner is kindness. And research finds that when young people are asked to increase their kind behaviors, they actually become more popular with their peers. Volunteering and donating money can help people to meet others who share similar passions and more deeply enmeshes people within their local communities. One study found that older adults who volunteered had more social connections 6 months later, but those who didn't volunteer actually had a decline over time. The joy of giving is written on your body. For example, when people donate money, the pleasure and reward centers of the brain light up as much as when they receive money. And my research finds that caring and empathic people have lower stress hormones during a challenging time. Giving can also make people physically stronger, at least temporarily. In one study, people who donated money were able to hold a 5-pound weight for longer than those who didn't donate. The feeling of making a difference is literally energizing. So, maybe you should plan a gym visit after you give. People who volunteer have lower cardiovascular risk factors, like lower inflammation, blood pressure, cholesterol, and body mass index. My research finds that volunteers are more likely to take preventative health measures, like getting flu shots, and they're less likely to end up in the hospital. Given this, maybe it's not surprising that research finds that volunteers have a 47% reduced risk of dying compared to non-volunteers. My research has compared different types of giving to find out which ones are best for health. I've found that older adults who see themselves as more caring are less likely to die 13 years later. Also, older adults who give their time, in any form, whether it's volunteering, helping friends, or caregiving, are also less likely to die. But those who give their money away don't benefit. This is actually good news. Most of us can try to become more caring, and most of us can spend our time doing kind deeds for others, even if we don't have much money. Research has found that giving time and money is associated with more happiness and health in older adults, middle-aged adults, young adults, teens, and even children. But the benefits of giving tend to become stronger as people get older, possibly because that's when years of habits, including giving habits, show their effects on the mind and body. People from many cultures around the world experience the benefits of giving. Volunteering is associated with higher well-being in 86% of cultures worldwide. and better health in 88% of cultures. Donating to charity is associated with higher well-being in 90% of cultures worldwide. These results are similar even in poor countries where resources are scarce. I'm going to wrap up by sharing 4 key ways that can help you to maximize your own joy of giving. First, V is for variety, the spice of giving. Research finds that giving in a variety of different ways and to different types of recipients makes people happier than giving in the same way and to the same recipients over and over again. Even your favorite food would get boring if you ate it every day, and giving is similar. If you want to maximize your joy of giving, try new kinds once in a while. Second, A is for altruistic attitudes. It's not always necessary to actually give in order to experience the joy of giving. The psychological aspects of giving and donating are as important as the behaviors themselves. For example, simply counting your number of kind acts each day can make you happier. Altruistic attitudes also matter, such as saying that you enjoy helping others or that you try to help even if others can't return the favor. In one study, altruistic attitudes had bigger happiness-boosting effects than actual behaviors. And in my research, seeing oneself as caring had bigger effects on reducing the risk of dying than actual behaviors. It's the thought that counts. Being ready to serve and help matters, even if actual opportunities for helping don't present themselves. Third, C is for concrete. Research finds that thinking of giving in more concrete ways, instead of more abstract ways, increases the happiness of giving. An example of an abstract way is trying to make somebody happy, versus a concrete example of trying to make someone smile. Finally, S is for social. The social aspects of giving are also important. For example, scientists have found that the happiness effects of volunteering double when it directly involves interacting with others compared to less social types of helping. We've been hearing about Vax in the news, but if you want to maximize the joy of giving, you can give yourself this Vax. Make sure your giving has variety, altruism, is concrete, and is social. In helping others, we are also helping ourselves. And during such a difficult time, we all need a little help. Thank you again to all you volunteers of the year for bringing so much joy to your community. And thank you to the Lower Keys Medical Center for sponsoring this event honoring them. Some people say we should give till it hurts, but now you know, we should actually give until it feels good.